Hello, welcome to video 5. This video examines one of the most consequential episodes in the opioid crisis, the role of Purdue Pharma in launching OxyContin and accelerating widespread opioid misuse across the United States. This wasn't simply a story of a new pain medication that carried risks outside hospital settings. It was a story of deliberate deception, greed, and institutional failure. The new drug combined far higher opioid doses with a cotton coating, which is supposed to slow absorption of the drug and reduce risks. Oxycodone, that was the name of the actual opioid product in the drug. So the coating, the cotton, didn't work well. And besides, consumers learned to crush the pills and either snort the powder or dissolve it in water and inject it to get a stronger, faster effect from the drug. Those who used the pills as directed found that the pain relief wore off well before the promised 12 hours, compelling them to use more than prescribed, pressing their doctor to increase their prescribed dose, and worsening their increasingly risky dependence on OxyContin. Nonetheless, Purdue Pharma promoted OxyContin as a drug with a low risk of addiction and safe to use over the long term outside the hospital setting. It funded messaging, conferences, and marketing strategies designed to minimize perceived danger and maximize prescribing. Their claims were false. Even as evidence mounted of rising fatal overdoses, they continued to use their wealth, connections, and high priced lawyers and consultants to maximize profits. Here's why this matters and how the damage unfolded. No significant new studies of OxyContin were done. Purdue argued that previous low-dose medications with the opioid oxycodone made OxyContin in quote, already improved drug, unquote. All they were doing was dramatically increasing the amount of opioids in the pill and getting rid of the other medications that were in the earlier versions of low-dose oxycodone products. Purdue Pharma never conducted serious research of whether this far larger amount of oxycodone in a pill was safe for extended use outside the hospital. They received easy approval for their drug from an FDA official, someone they later hired to work for them. Internal documents later showed that Purdue understood the risks far better than it acknowledged publicly. Warning signs were dismissed or downplayed. Aggressive marketing continued. Sales incentives rewarded high volume prescribing. Regulators, federal agencies, and Congress did not respond with the urgency the situation demanded. Oversight was fragmented. Government was painfully slow to react. This was the result of the result was 2 decades of widespread overprescribing, deep community exposure to opioids, and a generation of patients placed at risk without adequate safeguards. Many overdosed and died due to their use of OxyContin. When access to prescription opioids later tightened, about 10 million were already dependent. Then, as we will discuss in the next video, things got much worse. The hard lesson of this chapter is that corporate misconduct, when combined with weak regulation and delayed government action, can damage public health on a massive scale and result in fatal consequences. Many Americans have been directly impacted by the opioid crisis. Far too many families have buried a loved one due to an overdose or an addiction-related suicide. Tragic deaths that should never have happened. So what should change, and how do we prevent this type of thing from ever happening again? First, Congress should establish a permanent prohibition on senior FDA officials involved in the approval of drugs that pose a risk of addiction moving directly into employment with private sector pharmaceutical companies. The stakes are simply too high to tolerate even the appearance of conflicted oversight. These employees should be offered higher base pay to ensure FDA can still attract highly qualified officials for these very important jobs. Second, the country should establish an opioid crisis fee on pharmaceutical manufacturers to finance long-term prevention, treatment, recovery, and broader system reform. While Purdue Pharma and other companies have, through litigation settlements, contributed significant resources to support state and local anti-drug efforts, it pales in comparison to the enormous costs the country faces in light of the opioid crisis. The crisis cost the U.S. over $1 trillion a year in healthcare, lost productivity, criminal justice spending, and pain and suffering. A dedicated ongoing funding stream is needed. The pharmaceutical industry, which takes in $500 billion a year, can afford to give back 2% to help the country dig out of the opioid crisis over the next decade. Third, there must be a clear, candid, and publicly accessible accounting of how this crisis began through the National Opioid Crisis Memorial and Education Center proposed in video 3. Just the facts so everyone can remember how this happened. This would be kind of a truth commission. It would enable the public to see what really caused this horrible crisis the country was going through this past quarter century. I hope I've been clear about the indecent conduct of Purdue Pharma, but their misdeeds are not the only hard lesson about the development of the opioid crisis. In the next video, I turn to how government, insurers, and clinicians responded once the damage was visible, and how well-intentioned actions often made the crisis worse. See you at the next video.